all are safe, as I'm getting several questions regarding when, how and what exercises should be done after getting the COVID-19 vaccination. Here I am discussing certain important points that you need to keep in mind. Can you exercise after getting the COVID-19 vaccination? The simple answer to this question is yes, if you feel like doing it. Till now, no evidence suggests that exercising after the COVID-19 vaccination can affect its efficacy. So, it's safe to engage in physical activity if your body allows. As a rule of thumb, listen to your body and hold off on exercises, especially if you are having any side effects such as swelling and pain at the injection site, muscle pain, fever and fatigue. And if such side effects exist, then hold off on vigorous exercises for 1 to 2 days. And if you are someone who is active, then you can go for light walking and light exercises. But keep in mind that it can be counterproductive to try and push through high intense workout immediately after the vaccination, so keep it light. What kind of exercises should be done? Depending on the type and intensity of side effects, you can choose to go for a light version of your standard exercise program. If you only experience muscle soreness and fatigue, you can go for light aerobics such as walking, jogging and light weight training exercises. If you only feel arm soreness and the rest of your body feels completely fine, then you should modify your full body workout to only a leg and core focused exercises. Avoid high intensity exercise program for a couple of days, that is for 1 to 2 days. If you feel pain and swelling at the injection site at your arm, then you should follow CDC guidelines that you should do some general shoulder mobility exercises. When to stop your workout plan? After getting the vaccination, if you feel fever that is accompanied by cough, shortness of breath, runny nose and loss of smell and taste, it's possible that you happen to contract the disease around the time of your vaccination. So, in such time, you should stop or pause your workout program and start the treatment as soon as possible. Is outdoor workout advisable? Until you are fully vaccinated, that is 2 weeks after the final dose of vaccine, you should go for indoor workout, that is at home exercises. Even when you are fully vaccinated, it's important to keep in mind and follow the basic public health precautions like masking, hand hygiene and social distancing while you are exercising at outdoor location or some indoor fitness center. Any extra precautions while exercising after the COVID-19 vaccination? Yes. If you are dealing with other health issues like diabetes, hypertension and heart disease, you need to be extra careful in terms of type and intensity of your exercise program. So it's important to keep all the exercise and workout program under the guidance of some exercise expert. I hope this video would be helpful for you. And if you are having any queries regarding exercises or workout program, then feel free to comment below. Thank you, stay safe and take care.